Well, let's now turn our attention to the ongoing doctor strike. And as the doctor strike enters its fourth week, it is emerging that patients have opted to seek treatment elsewhere and wards in public hospitals remain virtually empty. Our reporter Nick Wambua has been on this beat and now joins us live for more. And good afternoon, Nick. Just give us a picture of which hospitals you've visited so far and what is the situation at the moment?
Thank you very much, Abi. And early this morning, we embarked on this issue just to check on the hospitals around town to see what is happening, and majorly the biggest hospital, referral hospital, that is Kenyatta National Hospital, just to see what has been happening. And just on arrival, Abi, the fact is that the management or the hospital management does not want any media persons, especially with cameras, just to access the institution, because when you're trying to just to paint the picture, they are fearing that they have their own fears that we do not know. But I was able to go around the hospital in some of the wards, and the fact is that the hospital is almost just like a skeleton compared to the situation in the normal days, because most of the wards are barely empty, and with the big population that usually visits Kenyatta Hospital when the situation is normal. Right now it is a different case, because most of the patients are now opting to go to some other hospitals other than Kenyatta National Hospital, which delivers which is usually visited by most of the patients referred from other hospitals and also from here in Nairobi. But then, Abi, we also visited Mbagathi Hospital, whereby we were also denied access. This because they do not, still again, maybe do not want us to show what is happening inside that hospital. But then, if you look at the number of patients that are visiting the hospitals, that is both Kenyatta National Hospital and Mbagathi Hospital, sorry, it is that the number of patients, if you look, it is quite very small, because in around 10 minutes, you could see around 3 patients, unlike the other days, whereby it is usually a beehive of activity, patients going in and out. And also, if you look at the patients that are coming in, they also report that some doctors are being called in to check on some of the very serious cases that are happening, despite the fact that they are on strike. And with some reported cases of KDF offering services in Kenyatta National Hospital, some doctors are being called in to come and check on some of the serious issues that are happening. But then after that, they just go away, they just disappear, and that makes them, because them staying in the hospital, it makes them an easy target. So, Abi, the situation, it could get worse if the Pharmaceutical Society of Kenya gets involved in the strike, as they had earlier announced, because they say that come 3rd January, if the government does not adhere to the CBA, to have the salaries of the doctors raised by 300%, then they're also going to join in the strike and make sure that there is a total paralysis in the health sector in the country. Back to you, Abi.
Well, many thanks there, Nick Wambua, just giving us the latest updates in regard to the doctors' strike. Of course, we continue to train our cameras on this developing story, which has sent a number of patients to seek alternative services across the medical sector. And that is that update from the health sector.